able to use that vacuum pressure to remove the object from the victim. It's as easy as place, push, pull. When you're finished with your training and you're ready to remove your mask, you're going to grab the mask and gently twist it to remove. Place your thumb on the inside of the mask and your fingers on the outside, gently twist, and remove your mask. Let's practice using the device to create a forceful cough. It's as easy as place, push, pull. To place the device properly on the choking victim, you're going to set the device just over the bridge of the nose and just above the chin. You're going to use a C for your index finger and your thumb, and an E for the rest of your fingers that will fit along their chin. You need to hold this grip for the duration of your time using the device. So we have place, and for push, it's a sharp, short push down, and then it's a sharp pull up to remove the object. It's as easy as place, push, pull. Thus, because LifeVac is accessible and easy to use, there's a growing amount of support around this amazing device. There have been a growing number of peer-reviewed medical studies as well as medical experts that support this device as a safe and effective tool to use during a choking emergency. It's an essential piece of gear for both lay people and first responders to have another piece of gear in their tool belt during a choking-related emergency. As we talked about earlier, LifeVac is meant to be used when standard BLS protocol doesn't work. And in some situations, for somebody who's in a wheelchair, standard BLS protocol isn't possible to be able to assist them. Same thing if there's a pregnant woman, you can't give the Heimlich because you could harm the baby. And so what LifeVac does is it gives everyone a fair chance during a choking emergency to have a positive outcome and to remove that choking obstruction. When using LifeVac during a choking emergency, if you were unsuccessful at removing the object after the first pull, here's two things to take a look at. First, you want to make sure that you had a proper seal. If there's not a proper seal around the victim's airway, you're not going to be able to create the vacuum to create that negative pressure to pull the object out. The second thing is you want to make sure that you're giving short, quick bursts. So not long pull movements. You want to do quick, short bursts to be able to pull that object out. Now let's answer 3 common questions that we get about LifeVac. Can you use LifeVac on yourself? Yes, you can. You just place it over your face and use it the same way. This can be great for people that are living alone, as giving the self-Heimlich can be very difficult. The second question is, can you use LifeVac on somebody with a beard? The answer is yes, although it can be more difficult to create a tight seal. There have been reported saves of people rescuing a choking victim who had a beard. And the third question is, can you use LifeVac for a person who's sitting, standing, or laying down? And the answer is yes to all 3. There have been reported saves of LifeVac being used for people who are sitting, standing, and laying down. And that's just one more reason that makes this device so powerful